I think that's like a number one way to avoid birth injuries is learning to
Yes,
use your voice and to speak
exactly.
your truth.
Well, I'm so excited to have you here. We've known each other for a while. We were just chatting before we came live. Sandy's one of our teaching assistants for our pro training, and she does such a fantastic job just like helping us educate all the pros. And Sandy and I met many years ago at a Katie Bowman training. We both, worked for Katie Bowman for a while, Nutritious Movement, and now we're continuing, which is super fun. So Sandy, tell us a little more about you and kind of what you do before we get started.
Yeah, so I've been doing movement education for almost 40 years now. And I always joke I've done everything from teach aquatics to Zumba. And currently I own a yoga studio and we have classes 7 days a week. So pretty busy with running the studio, but I also see clients privately and I organize workshops and I try to really focus in on female pelvic health. Both for my own personal reasons, as a person I'm almost 63, so I've gone through all those phases of life, but also just to know that it's so important to empower women right now, especially in our society. So it's a passion for me to do kind of to focus my work in here on these reproductive years.
Yeah, and thinking into like menopause, perimenopause. Like I'm gonna be 40 in April, which is wild and exciting. And I'm even thinking about that journey. But we're talking birth injuries, and I feel like thinking forward into the rest of your life, like you get your pelvic floor for life, right? Like this is my pelvic floor, this is my body. And I find that pregnancy is a time where people tend to have more motivation maybe to focus on it, right? So it's like, well, it's not necessarily the pregnancy's fault. It's now there's a pregnancy with all this other stuff that's been going on, and now it's showing up as, oh, now I'm leaking urine, right? And I find that the injuries and the issues that can come up during pregnancy, it's just a lovely opportunity to support yourself and to maybe prevent some injuries that have some long-lasting effects, right? Like, how do you see that journey, through the life cycle of the pelvis?
Yeah, I started a lot of my private practice with people who were my age who were experiencing those things, and then I, reflect back when I'm taking in their health histories, and like I had one client who, she had some issues, and I said, have you been pregnant before? Yeah, I've had, two pregnancies, and then later on I kind of go down and I ask, well, have you had any surgeries? Like, no. I was like, oh, okay, so those pregnancies, those were vaginal deliveries? And she's like, oh no, those were C-sections. And so, we really want to kind of get the idea that kind of broadening, and I kind of don't like to use the word injury because injuries happen. Life is full of, things that happen. I tore my labrum 5 years ago and ended up with a hip replacement. But what we really want to do is I like the word prehab. We want to try to prevent what we can. You talk about, like stacking the cards in your favor. But life is kind of a house of cards. It's there's inherent risk, and so I think that pregnancy brings on this motivation to have some empowerment in their birth and in how they go forward in their lives. But it's also a great opportunity because of the added loads of pregnancy, because of the added physical effort of birth. It's a great time to also understand kind of some of the predominant patterns that we have in our movements that, aging is another time when we're starting to have added loads, right? We start to have added challenges. So we kind of can become alert of those and then do what we can to prehab, not only for the pregnancy and birth, but for our whole lives.
Right. I know. I think sometimes people don't realize like the same stuff that helps you stack the cards in your favor, as I like to say, for a more, not just efficient birth, but a more uneventful, I call it like we want a boring birth, right? Is the same stuff that helps you, do a rim to rim of the Grand Canyon without knee pain, right? Like it's the same, whatever it is you want to do with your body, like let's get your body prehabbed. And I always say, like, it's easier to prehab than rehab, but we can do both, right? And so prehab isn't as like sexy. It's not like, when there's not always as much motivation to prevent an injury than to, like, you know, heal from one. But I do think there is a little bit more motivation, like you said, during pregnancy, because you're like, wait, this has to go through that, like, what? Like, you know, we get a little nervous, which I get. It's a big experience. And so it's just a lovely opportunity. So let's talk about some ways. So I see, like, in preventing injuries during birth, I kind of see two buckets. So we see, like, the prehab bucket or the prevention bucket, and that starts in pregnancy, right? Like, there's a lot we can do in pregnancy to help those tissues yield better, to help that baby find a better position for a smaller surface area to get through. And, like, there's so many things. That's, you know, like, a lot of what we do together is helping people with their prenatal prep. And then there's also this other bucket is, like, what can we do during the birth itself? And there's a lot of things we can do in the birth itself also to reduce those injuries. And we kind of need both, right? Like, talk me through your thoughts on that.
Well, first of all, we have to kind of define, like, what we think are the potential injuries, right?
Yeah, let's do it.
And so, first of all, you know, during birth, there's going to be some separation of abdominal musculature. So diastasis recti. And again, is that an injury or is that just, you know, a change, you know, in those loads to the body? But it could become an injury if it doesn't heal postpartum. Prolapse is another thing, you know, especially if you have a vaginal birth, but prolapse can happen even if you don't have a vaginal birth, because the tissues have just been so stretched and so changed. And again, that's not necessarily an injury, but it can become an injury if it doesn't heal correctly. So those are things that are kind of inherent in the birth process. Tearing can be another injury that we have. And again, you know, if it's minor, it's not a big deal. It'll heal quickly. But it could be deeper, and that could be, you know, from the force of the birth. So that's getting a little bit more into the birth. And then, of course, any incisions that are made, and you know, again, those deeper tears that might happen with the use of vacuums or forceps. So those are the kinds of things I'm kind of thinking about when I think about birth injuries.
Yeah,
right.
For sure.
And
I
so,
mean, and then that's the other thing is, like, is it from the birth or is it from, like, pregnancy? And it's kind of both, because I think a lot of people, what came up for me when you were talking is a lot of people say, oh, well, then I should just have a cesarean because this is inherently going to cause injury. But you may, and there's nothing wrong with, like, someone choosing a cesarean, so that's not what we're talking about, but you always have, you know, an injury, a surgical incision, versus you may or may not have a tear. So and like you said, prolapse tends to be more of a prenatal injury associated with, like, pressure mismanagement, not always associated with the birth itself. So I think that's a thing that I just want to throw out there, because people get a lot of pushback when they're wanting to say VBAC, and they're like, oh, you got to save your vagina, and that's not it. That's not
I had two vaginal births. My vagina's great.
Yeah, I had four vaginal births, and it's funny because I think a lot of people, like, they don't realize, like, I weigh like 105 pounds. Like, I wear a size 0. I'm very small. My biggest baby was 9 pounds 1 ounce. So it's not about, like, your size. It's about just your body's ability to move into different positions. And I think the thing that we think about, the thing that's become very trendy on this platform and social media is, like, really focusing on, like, birth positions, right? And I love birth positions. Like, birth positions are amazing. And I was, like, one of the people 10 years ago talking about, you know, internal hip rotation. But I think we're missing a big piece of the puzzle when we're telling people, oh, it's going to be easier if you internally rotate your hips. So they call it, like, knees in, which, whatever. Yeah. You know, I hate that term, because knees in is not the same. But the thing is, of course, I have pelvises surrounding me. But, like, if somebody, we talk about patterns, if somebody is stuck in a pattern of, let's say, external rotation, glute gripping, a lot of compression back here, you know, duck foot, whatever. We talk about this a lot, right? And then you say, oh, you know, internally rotate your hips. Well, like, right. How do we do that? Like, I can't. It's not available. So the goal isn't to then force it at birth. Like, that's going to cause that can cause an injury too. Like
Right. Yeah, that could cause a hip injury, right? So that kind of
exactly.
forcing the hips into a position that they're not used to being in. I have a friend who has a hip injury that's exactly from that, being in the lithotomy position and being forced
Force
into,
this way.
yeah,
Yeah.
into a rotation that her body couldn't handle. And especially if you're under any kind of anesthesia, if you have any kind of spinal block, your muscles aren't going to even be able to resist that. And so the injury can be pretty.
Yeah, it could. And I had a virtual client who got a hip injury because she was forced into a position at birth. And the thing is, we don't need the most outlet open position, right? Like people say, okay, internally rotate, flex, this, that. The goal is not to have it the most open. The goal is to have all the movement available, right? So that it can do what it needs to do.
Right.
But not just forcing this. That's not it. Did I have to do all these did I internally rotate my femurs when I pushed? No. But did I have access to that movement? Yes.
Right. And I think that's the key, because if we haven't done that prehab, if we haven't kind of I like the idea of just playing in our bodies. If we haven't really played in our bodies and gone to those end ranges and had curiosity about what that feels like, then we don't know that it's not available to us when we get into a more acute situation. So, there's that saying, it's gosh, I wish I knew then what I know now. And that was really true with my own births. My first birth was a home birth. And I was very physically active. And, I think especially when you're young and you're super physically active, you kind of have this idea birth is going to be a breeze, right?
Yeah, I'm fit. Yeah.
I'm going to rock this, But, my story was that I had, my first labor was over 36 hours, right?
Yeah.
And I have to say, I loved pushing. Pushing was because that was my jam, right? To be able to kind of be physically present for the birth. And that first part was about letting go of that control. And that was part of it. And, and then later on, in my 40s is when I started having a lot of stress incontinence, right? And that's when, and back, it's 20 years ago, people were just Kegling 100 times a day and stopping your flow of urine. And that was kind of the answer to having stress incontinence. And it was when I learned no, I have too much tension in my pelvic floor from all that exertion, from all that. And there's nothing wrong with working out. There's nothing wrong with being physically active. I wouldn't trade that time in my life for anything because I loved it. But, I wish I knew that I had a tight pelvic floor. I could have made it easier on my midwife and myself and my husband, not having to have such a long labor. And thankfully there was no injury, there was no problem from that. It was just long. But, had I, worked more intensively in figuring out, what my hip movements were accessible to me, had I known, that, we want to have that yield of the pelvic floor, it could have been a shorter labor. And long labors can lead to more interventions, and more interventions can lead to things
injury,
injury, forcing through again, the use of vacuums or eventually C-section, those types of things. Especially, we really want to I kind of we need to work with ourselves. First of all, we have to educate ourselves, and we're talking about movement. What I love about the Body Ready Method program, though, too, is it's an education program. It's not just an exercise program. You have really put in the information, whether it's parents taking the program online, or especially the people that you train through BRM to become certified pros. It's an education program. It's not just do these exercises. And so much better than in the days when I would take prenatal exercise teacher training or whatever, and it'd be don't do these things. That's
Right.
what it
Yeah.
was 40 years like. Don't do this. Don't get your heart rate up. Don't do this. Don't do that. Right? No high impact. Blah blah blah. And now at least we're saying like do these things, and we're giving people the education they need to understand the whys of doing these things. Whether you're a certified pro or you're a parent. But then the next thing is to have those courageous conversations about what birth means to you, and
Right.
what you really want to do, what you're willing to do to create that, to prehab that. And then you need to
Yeah,
get
for sure.
organized with a support team that supports you in those values.
Absolutely. And I think, so we talked like prenatal prep, which is so pivotal and so important and so much more than just like memorizing birth positions. It's making your body like, I always talk about it as the group project, like getting all of your parts doing their job. If someone's not doing their job, I was just recording a video about this, so the Instagram folks will see this at some point. It's like, if my femur doesn't move in my hip socket very well, which as it moves, it pulls this along for the ride, and that's how we get all this different mobility. If it doesn't move, we're going to find the movement somewhere else, right? We're going to waddle, they're going to get stuck together, and usually it's the lower back, right? It's like the back gets all that, and then we're like, why do I have back pain?
Right.
Well, let's get this moving so that this isn't moving, like trying to take all the movement. And so that's a huge piece of the whole puzzle is the prenatal prep. But now you had a lovely segue with what you said about what can we do in the birth itself, because the first thing you said I want to pull out is something like getting your team, right? We prepare our bodies, we prepare our minds, and then I guess this is actually prenatal prep too. It's like, who's your team?
Right.
Because if your doctor they give an episiotomy at every first-time birth. I was just at a training this weekend. I didn't realize places still did that. Like every first-time person gets an episiotomy, which is the equivalent of a second-degree tear. Blew my mind. So like if your provider's doing that, if you ask them in a prenatal, hey, are you cool if I give birth on my hands and knees? And they're like, oh, well, it's really better for you to be on your back. And you start to get these red flags. Like, it can be challenging to move, but like, it's really not fun to fight through your birth. And so, like I always say, if you want Chinese food, go to a Chinese restaurant. Like the Italian restaurant, they may be good people, but they don't know how to make good food. Like they don't know how to make that. So even if they're trying, it's not going to taste the same. The tip I always give is like talk to the doulas in your community, because doulas tend to have the best pulse for the birth culture of their community, and they tend to know like, oh, this hospital, they're going to, 60% of them are cesareans. So if you don't want a cesarean, then maybe don't go there. If you do want a cesarean, they're really good at them there, go there, right? So like not everyone has to have the same hopes and dreams for their birth, but you just have to find someone that aligns with what it is that you want.
Yeah,
and
those
values. I have no judgment on that, right? Like I don't care if somebody wants an epidural, great, then get an epidural. Like there's no judgment. It's all just how can we support you to get what you want in a way that is like not gonna provide injury. So absolutely, if somebody's planning a medicated hospital birth, they should still have a provider who understands and is supportive of different positions, getting on your side, getting on your hands and knees, because yes, you can get on your hands and knees with an epidural, and there's so many different things you can do to help like reduce the injuries in the birth itself. I mean, let's just like tag team some of those options. For me, I mean, let's start early labor. I think the first thing is maybe don't go to your place of birth right away, right? Like I always say, like the sooner you get to the hospital is not necessarily the sooner you give birth.
Yeah.
It's just the sooner you're at the hospital.
Right. Yeah. And I think, even like in choosing whether or not you have a hospital birth, like,
Right.
So, again, kind of really honing in on those values, and those values can be really broad reaching, like, I hosted like 20 years ago, I hosted a Choices in Childbirth, like forum, and I had, like a midwife and a labor and delivery nurse, and, I kind of experienced this with my own home birth because my mom was a nurse, right? And she was just like, oh, it's dangerous. And I was like, I started out in nursing. I kind of know hospital protocols, and there's some risk in hospitals as well as in home birth. So again, what are those values? And honestly too, part of those values, and I know we're speaking about the parent and the pregnancy and the birth and all of the personal stuff, but what can you afford? Like what is your monetary situation? So that's a value too, because like for me, the first hospital birth, we were in graduate school. I had no health insurance. I had to choose something that we could afford. And it just turned out that it really aligned with a lot of the other values I had. So courageous conversations around those values. And, if like I live kind of in a rural area. We don't really have a lot of choices in hospitals. If there's a hospital that has a high cesarean rate, then that's going to be probably what you're going to have as far as your choice. All the providers will be in line with that because that's the hospital's protocols. So, those courageous conversations, those things where we really hone in on what our values are and really list them, right? Because then you can prehab for that. So if you're in a place and hospital birth is where you want to go and it's a hospital with high cesareans, now you start to say, okay, well, let's not go in very soon, because there's usually like a 24-hour situation, where if you go in and, your water's broke, hospital protocols have changed so much, but in my day, it was like 24 hours and they didn't take your temperature and they didn't test for infections. It's just like, if your water broke on this time at 10 a.m., this time by 10 a.m. tomorrow, you're going to be, going in for a cesarean. So things have changed. And, it's just, again, it's really just thinking about what your choices are based on your values and the availability of what you have there, and then start to educate yourself about how to prehab for the situations, not just the body, but the situations you find yourself in.
And I think to add to that, if you're like, well, my only option is not a super great option, and I do want or need a hospital birth, I think it comes down to advocacy. Self-advocacy is huge, right? I'm going to quote Tracy the doula, who is on here on Instagram and TikTok, because I went to her training this weekend, and she said, you can never advocate more than your client's willing to advocate for themselves. And I love that she said that, because maybe she's here, I don't know. But because it's very true, like you do have to take personal responsibility for your own birth. Absolutely, you should hire a doula to help support you. Doulas don't just support unmedicated, whatever that means, births. Doulas support all types of births. I go into cesareans. I go into planned inductions, all types of things. And we are there to help you understand and know your rights, of course, to help you self-advocate, to help advocate for you, but then also to help you with that decision making as things go forward, because there is sometimes room for decisions, and knowing like your value and educating yourself ahead of time is a big part of knowing like what could happen. If I say yes to this, then I'm kind of saying, if you say yes to the epidural, you are saying yes to like, okay, now I'm not moving. Now I'm have to have an IV. You're saying, like, know the things you're saying yes to when you're saying yes to something, and know also that's okay to decline things. Like, just because it's hospital protocol does not mean that it is right for you. If they're saying don't eat and you're saying, well, my uterus is a muscle and I want to eat, then they can chart that and you can eat, right? Like you're the client. Like, I think the hierarchy, like people think like, well, it's the doctor, and then it's the nurse, and then it's like me at the bottom and the doula even lower. And it's like, no. Like, again, I'm quoting Tracy back. She like really centers the birthing client and the doula, and then like we're all collaborating on that care. And so what does that look like, right? Like that looks like, okay, so let's give them some tangible things. First, not going in, if you're hospital birthing, maybe not going in too early. When you're at the birth itself, like, it seems silly. You're like thinking Lindsay's going to tell you about like a hip thing. Dim the lights, turn on some music, groove, dance, get out of your thinking brain, get to your intuitive, like more deep limbic brain, and just like stop overthinking it. Like the time to overthink it or to think it is pregnancy.
Right.
In
exactly.
birth, like you show up and you move and you breathe and you make sure the people around you are supporting you, and you like allow yourself to do, like, you have information we don't have, like you're dancing with your baby, so move, flow. Don't be like, what position would Lindsay want me to be in right now? Or like, no, the position you're intuitively finding is the right position, right? Like, I really do. People think I'm the doula who goes and like manages it, and you don't manage someone else's physiology, right? Like, you allow their physiology to guide the show, and I'm just there supporting that. And if there is a stall, yes, I know, a tissue to release or something to do. So that's the next step, is just having someone there who understands what that means to support your physiology, to support your labor flow state, which is like tuning inward. Having people to support that does reduce injury.
Yeah.
Because think about, if you are pushing on your back, which is another thing, with your legs in extreme end range of motion. So think of a rubber band pulled really, really tight, and that's what they do, right? Extreme end range, really tight. And now I push through a really tight tissue. Is that the best way to reduce injury? Or let's relax the legs a little bit, allow the birther to like choose what position makes sense, not forcing their knees together either. And then let's like if there was a spotlight on them, they're on their back, like Ina May Gaskin, our sphincters are shy, right? And I really believe that increases the chance of tearing. But I feel like that's the key, is to like keep things calm, keep your nervous system calm, as calm as it can be for this really eventful, intense experience. Like, keep ourselves tuned inward, and I really do find that reduces tearing.
I want to kind of jam on that too, because I think a lot of times, and it's maybe, like, we have a lot of verbiage around, like, your body's made for this, and you can do this, and I think positive affirmations are great, but I also think we need to, again, have these courageous conversations. Like, it's going to be work, it's going to be effort. And I think that that's a really important thing, because everybody gets to the point in the birth where it's like, oh, I can't do this, and then you do it, right? And so I think that, the people who are, working on that prenatal, so I call myself a prenatal doula. I don't attend
That's
births,
lovely.
And again, kind of like, it's a team, right? I've been teaching movement education for 40 years. You probably won't find a doula who has that kind of movement experience. And again, I really appreciate what you're doing with Body Ready Method, because it is teaching that movement to the people who attend birth, so they can understand, because they're going to get some prenatal, experience from that person as well. But, we really need to, again, have courageous conversations about, this will take effort, this will take work, and, we need to not only have the prepared, like things like, I do not approve of this, thing you're doing, or, I want to move in this way. So practicing it, with the mouth, saying the words, I think is really important, right? And then also, having maybe practiced something that's hard and noticing, how does that affect your flow state? I teach yoga, and so I like to get people in these, and I'm not a bendy person, right? I get people in positions where they're being challenged, and how do they meet that with equanimity?
Sink into it.
Yeah, and breathe through it, and so that needs to be part of the prehab too, that, how do I deal with challenges, physical challenges? Like I said, for me, I had done triathletes. I had triathlons. I had met physical challenges, ones that were really like beyond my capacity, but I made it through. And so that's why I love pushing so much. It was just this awesome, like physical thing,
It's like mindset, right? It's like the mindset of you made me think of, I love, we teach in our Body Ready Birth about the skill to challenge ratio. And it's like, it's not just, I am high skill and this is a high challenge. It's like my perception. It's not the actual, like, if I believe that which is confidence, right? The perception of your skill is really confidence. So your confidence going into the birth, wait, that can reduce birth injuries, to believe in myself. What? But it's so true. Like if you believe that you can do this, and you believe this is like gonna be strong and challenging. I don't like to see it painful. My births weren't painful, but they were effortful and they took my focus, right? And so it's like, I believe I can do this. I believe this is gonna be a challenge. And then that's where you get the flow state. You don't flow when you're bored. Like
Right.
I don't flow if something's easy. Flow state is like I've read a lot of research on flow state, and it's like when you are like free soloing the side of a mountain and everything matters. They have researched the brain states of these people. They literally get access to intuitive wisdom. They know what to do. We get access to that during birth as well. Like
Absolutely.
we go into that if we allow ourselves to go there. And that's why I call it the labor flow state, because I was realizing when I was looking into all this flow state research, oh my gosh, that's birth.
Right.
And it's like, if you can get yourself there, that is going to, and you can ebb and flow, but as the challenge raises and your confidence goes down, then you go to anxiety, right? And that's when we're freaking out. So then you go, okay, so what can we do to make either build my confidence or reduce the effort, or both, right? And so that's really what doulas do, is we help people kind of stay in that state that helps them to have access to the wisdom that gives them the birth position that doesn't create the injury.
Right. I think it's so cool too, because, like we talk about our bodies are made for this, so when we are laboring, right, oxytocin is actually coming from our brain. It's released from the pituitary gland in our brain. And when it becomes really intense, that's when we start to get the endorphins from our brain as well, that give us that flow state. And so one of the issues with like an artificial induction of say, Pitocin, which is a chemical that's very similar to oxytocin, right? But it doesn't get into the brain because it's put in from the outside of the body. It's injected, right? And so that's why when we see someone starting with like induction, we start to see a cascade of other things happening because that flow state's not coming from the brain. So we have to have even more externalized management of the environment to allow the flow state. Like when someone's...
I want to say something with that though, because I go to a lot of inductions too, and I will say when people perceive that the induction's going to suck, and they perceive Pitocin is the worst thing ever, then it is.
Right.
But if somebody can enter into, okay, let's say my client is needing an induction because they have itchy hands and feet and they're starting, like doulas are like, oh, we know what that is. Like they have a medical reason they truly need to be induced, or they want, like it doesn't matter, whatever the reason.
Right.
Getting induced. If I can enter into that with confidence, if I can enter into that, I go to people's houses pre-induction and I get their body balance and I help them release different tissues. And so we're stacking the cards in their body. Yes, maybe it wasn't ideal. Maybe it wasn't their plan, but like not everything has to get thrown out the window. You don't have to get birth injuries just because of this. Does it maybe increase the intensity of the experience? Yes. Does it maybe block some of our hormonal factors? Yes. But you can still develop oxytocin. You can flow. You can dance with your partner. You can, you don't have to let it be. I feel like I just want to throw that out there because people get really scared about Pitocin.
Yeah. And I'm not trying to make it be against Pitocin. I'm just saying that then if that is the way we go, then like you say, you have to get the partner there. You have to, because it's not going to just come from the chemical reactions in the brain.
Right. Yeah,
so
totally.
So I'm totally in agree with you. Yeah. And I had Pitocin with my second one. So, so I know what it feels like. I can say that I enjoyed the labor a lot more without it.
Yeah. I had an induction for my first. And the other thing that I did that I think increased my chance of birth injuries is I got the Pitocin. Of course, I didn't want it initially, so now I'm freaking out and I'm tense. I'm like resisting. And every time I got a contraction, and I see this a lot, especially first timers who maybe don't have a doula or a lot of childbirth education, what do we do when we get the contraction?
Tense up, yeah.
We fight it, we resist it, and that makes it more painful. That is making your brain say like, I'm not safe. I need to get somewhere safe. Your uterus is going, well, we don't want to give birth while we're running from a tiger, right? Like in our brain. So that's slowing things down. And then it like, well, okay, now it's slower. So now we need more Pitocin. And now it's more intense. Now I needed an epidural, which is my first birth. Got the epidural. Well, by the time that even started, I was like pushing, but then I was so numb I couldn't feel the pushing. So then I'm on my back and there's, okay, hold your breath in. And they're counting to 10. Take a deep breath. And it was like, and then I tore, and then I was like, wait, what just happened? And I do remember a very kind nurse being like, hey, you want to go in the tub? Like she was willing to take me and all my cords that were everywhere to the tub. She got it filled up. And then I was like, okay, there's a cord in me. I had an internal monitor. I had I had cords everywhere. This baby's turning 18 in 3 weeks. I had cords everywhere, and I was like, I don't know. I don't want to move. How am I going to move? She convinced me to just like move into a rocking chair, and I was like, all right. And so it really perpetuated this cycle, this cascade that I could have eliminated by just like, if I had one person there, like a doula who would have been like, hey, Lindsay, I know it's really hard. I know you don't want to move. Let's just do it together. I got you. Hold my hand. We're going to go just one step at a time. Oh, you got one? Okay. That's okay. Hold it on right here. And I think it would have been lovely. And my partner was amazing, but he's never done this either. He needed someone. And like as a doula, we're feeding the partners. And so I do think like having people there is huge. Prenatal prep, having someone there. And then also like advocacy. I do feel like there's a lot of outdated practices that are not necessary. You don't realize they're outdated. Like, oh, this is just what the hospital always does, right? Like they always have me on my back. They always, and it's, evidence takes, what is it, like 12 to 18 years to move from like, oh, this is what we found in research to what we're doing in clinical practice. So that's a really long time.
I mean, and some of that is it's not really even evidence-based, it's more liability-based, so kind of understanding those kinds of things too. But yeah, so, like for me, when I went in for my induction with my second birth, knowing that I had a really long first birth, and the second birth, I talked a little bit about the values of the financial parts, and this is real, like this is real life. My second baby, we had complete insurance. I paid $5 copay for everything, and I never saw a bill. And so I knew I was going to have a hospital birth with the second one, and I knew that I had a long birth with the first one. And so I knew with my water breaking, I had 24 hours. And so for me, getting the Pitocin, again, it wasn't a very enjoyable labor, but my value was I didn't want to have a C-section, right? So again, so I was fine with the Pitocin and with the effects of it and everything, because it stuck with my values that I knew I could birth this baby. Right? I knew I could have a vaginal birth because I'd had it before. And so I went in, again, educated to know what it was feeling like, educated to know what my body was going to be like. And the only thing that was kind of an unknown was what that chemical would feel like. And so, so I didn't freak out. I was okay with it. It did get really intense. They kind of over Pitocined me.
I feel like, that was how many years ago. I feel like most places have gotten better at not just bump.
So this was 30 years ago. And they just kept doubling, and my sister was my doula, and she was a labor and delivery nurse. And so she saw what was happening, and she saw my contraction chart, and she's just like, I think you could probably turn that down now. But it was a little too late. So I did have an epidural, but again, it was all staying in with my values and what I could do. And so the courageous conversations and getting really attuned with your values and knowing that you're going to make some choices. And again, there's some inherent risk in life, but birth is a big event. So, if you're training for, competitive sports, right? You do all the stuff beforehand. You don't, like, I didn't, when I went to run my first half marathon, I didn't just like show up one day. I did a lot of training, right?
And hey, that you know what makes me want to ask you, because I think you're going to feel the same way as me about this. Was your training for preparing your body for birth perineal massage?
Oh,
What do
so
you feel about that?
yeah, so with my first one, because it was my first birth, it was with a midwife, and I was living in Nashville at the time, so we had midwives who were trained with Ina May Gaskin, right? It was kind of like I was maybe 30, 40 miles from the farm, so. And in fact, after I had my birth and my husband was trying to get into graduate school, like plan B was to go to the farm. Like that was like we were literally, that was plan B. So she recommended the perineal massage, and we did it because it was what was recommended. And but I also had hot compresses and a real patient midwife, and given all the time and the capacity to move, right? So did it make a difference? I don't know. We did it with the second one too, just because, even though that doctor never mentioned it, never said word about it, right? I can say that one of the benefits, whether or not it helped with tearing, because I didn't have very much tearing with either birth, but one of the benefits was just that feeling of kind of acute pressure on the perineum. And just kind of, again, preparing yourself. It's not like doing perineal massage with your partner is not sexy time. It was actually not comfortable. So again, just dealing with that sensation of like, how do I, and having it not be traumatic, right? Because it's with somebody you trust, and you can tell them to back off if they need to and stuff. So, so that to me it was valuable. Again, was it valuable in that it reduced tearing? I can't answer that, because that would take a lot of. That would all probably be impossible to have evidence base for that. Right, because
they do have some evidence a little bit. So this is like whenever someone's like, oh, you're preparing your body for birth, you're trying to prevent tearing, which is a big birth injury. A lot of times what people give for that is perineal massage. And to me, I find the most benefit I find in perineal massage is if somebody's had a previous tear, it's really helpful to be able to massage that scar tissue. However, I think when we only focus on perineal massage, we don't address, wait, why are those tissues tight?
Right.
Like we are just massaging them. It's kind of just like releasing a tissue, but not addressing why it's tight. And I find it's kind of a spot treatment. It's kind of like a cop-out to not do the more like intentional actual work needed. And the studies show that it reduces episiotomies. It does not reduce necessarily tearing, it reduces episiotomies. To me, that means if my provider believes that I have been doing this, they're more likely to be patient and they're more likely to not cut. So that doesn't necessarily tell us, like when people say there's evidence for a perineal massage, it reduces surgical cuts, it does not necessarily reduce tearing. And again,
yeah, and I would say that if you're
also just have them believe us all the time that our tissues have the ability to.
Yeah, I would say that if a provider does recommend it, then yeah, it's their belief in that the tissues can release. Yeah, and they're kind of counting on that evidence coming. There's always inherent bias, right? So
exactly,
yeah.
Of course.
So yeah, so to me, it was beneficial from a perspective of experiencing pressure.
Yeah, and I feel like if somebody feels like they need that, like the benefit is if you think this is going to be helpful, then it will be.
Right.
So if somebody's like, I really think I would benefit from feeling that and breathing through that pressure, that's amazing. But for someone else, like I never actually did it because I was like, I don't feel that I need that. And for some of my clients, they actually get really anxious feeling that.
Yeah.
And that sensation doesn't have the hormones, those really amazing cocktail of natural pain-reducing hormones that we get in birth. And so it's kind of just like, I just wanted to throw that out there because everyone's probably thinking, oh, common birth injuries.
Yeah.
Reduce injuries
I think
by massaging.
a better approach is hot compresses.
Yeah, that can be helpful, like during the birth itself.
Yeah, when you start to feel that ring of fire, that felt great. Like that hot compress was just
Yeah.
like, oh, and so the
Water birth.
tissues, if something feels good, the tissues tend to relax more too, right? So yeah, coming in, making sure you have the capacity for a mobile and supple pelvic floor, absolutely, right? But then I think the perinatal massage. Yeah, I can see how like I said, first of all you have to have a partner, someone who's willing to do that with you and put you in a safe place for it. And that may not be everybody's case. But
And then during the birth itself, they do sometimes very extreme stretching. I am personally not a fan most of the time. I think it is very invasive and it can actually introduce some micro tears that can perpetuate an issue. It's just this belief that our bodies aren't designed to stretch in this way when they really, really are. And I find that, again, typically when they're doing that, someone's on their back, there's a spotlight, the flow is gone, and they're pushing really, really hard. And then the final thing, and I do this for out of hospital births, like everyone. Another thing that I found is like just a really tangible tip that I want people to hear, to use is, and doulas as well, because I will do this for my clients, is that when the head is crowning, when it's like this much of the baby's head is out, like it looks like this, it's a strong sensation. It's like very strong. That's the strongest sensation I remember of my birth, is this moment. And a lot of people, when they feel that sensation, they want to get away from it as fast as they can. So what do? They push really, 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 really hard. And I have found when you feel that really strong sensation, maybe the contraction's over and your baby's here. And the next contraction, their head's probably going to be born. What I tell people, when the baby's head is here, when the next contraction comes, you actually oftentimes, unless there's a need and your provider's telling you, you often don't have to push that hard. The contractions at this point, I'm just, I'm exhaling down, and sometimes I'm not even doing that. Like for me, my babies fly out, I'm just like, and I'm just resisting, and that contraction is what's birthing the head. And then you're not pushing it out so forcefully. It's like easing the head out, and that oftentimes reduces the tearing. I remember one particular client in 2020, I'm in her ear, she was having a home birth, and I'm like, okay, breathe into that pressure, like or whatever I said, in the moment. I'm in the flow with them. Breathe into that pressure. Okay, now breathe your baby's head out. So when people talk about like breathing their baby out, that tends to be what we're focusing on, is when it's right here, you're not breathing them out from here. You're not just, I think people take that wrong. It's not like, that's not breathing your baby out, right? It's, yeah. It's like Serena Williams hitting a tennis racket. Force, right?
Yeah.
Power.
I know when I was.
So any other tips you have for people? Just like I know we've talked for about 50 minutes. I want to just bring it home for go to if you could talk to your former self, you're pregnant with your first, you don't want any injuries, or you don't even know that injuries are possible, what would you tell yourself? I know that's a big question. Whatever comes to your brain is what you're meant to say.
Yeah, well, I guess, I was so blessed to have a team, my midwife was awesome. And, again, our values weren't necessarily having a home birth, but it was having a birth that I felt safe in. So that's the first thing, is what makes you feel safe? And then build your team around that. And again, first of all, what makes you feel safe, you need to educate yourself about what the real inherent risks are. And then build your team around the values that you found that do help you to feel safe. We won't birth in an unsafe situation, right? I mean, that's a real known thing, you don't feel safe, you don't get any flow state, everything shuts down. So, so creating that safe bubble for you to give birth in. I was raised in the country. We had a dog that had birth like every year we had puppies, right? And the first thing she would do is she would start to look for her safe place. Oh, there's your dog. She would start to look for.
So she's like right there.
Yeah, she would start to look for her safe place, and she created this little nest that she would have her babies in, right? So creating that sense of safety. And that comes with education and knowledge and courageous conversations so everybody knows who you are and where you stand. And then I think that for me, now, done with babies, all of that, recreate the village. That's been my thing, is revillaging. We need to work together. Those of us who have some basis of knowledge that supports families in communities for the future. We need to revillage. We need to connect again. We've become super isolated in our culture, and having courageous conversations among our friends, and whether it's about birth or menopause, there's more and more information around now coming around about menopause. And, whenever I talk about it, people are like, well, nobody talks about that. It's like, I'm talking about it right now to you, right? So find the community that supports you, and that doesn't just include your peers. Right, that includes people who, the elders like me, that I can say that not taking care of how you pattern your movements in pregnancy could have a lifelong effect. That if you don't address, your hypertonic pelvic floor in pregnancy, and you have, a lot of interventions, like this could affect your continence in your 40s, and how you experience perimenopause and menopause in your 50s and 60s. So
true.
Yeah, so I would say, have a scope, have a long scope, and that includes having your support team be broad, and
The number one, I think this stat is the number one reason people move to elder care is incontinence. And a lot of that starts with their births and their birth experiences and their pregnancies. And it's just a really lovely opportunity to learn more about your body, to grow stronger in your body. It's a lovely opportunity to find your own self-worth, your own, like I always say, advocating for yourself through pregnancy and birth, people are going to have an opinion about your baby and what you choose to do with them forever. Right? They're going to have an opinion about how you feed them, what school they go or don't go to. My oldest is going to be an adult in a few weeks, and people still have opinions. And so starting now when you're pregnant, developing healthy boundaries, developing your community, because getting resources and getting in a community is also going to help I should go to this hospital, I should avoid here, or it's we're sharing resources, we're sharing within our community. So I think, I think one thing I would add to that is just to know that you're in charge. Because I think with my first, especially, I was pretty young. I was 20 when I had my first baby, and I was a yes girl. I have a midwife, so they're good. So all I need to do is just say yes to everything, because they know better than me. And it's outsourcing my, they don't know more about my body, right? They don't know more about my birth. And so I think that was, part of me doing my own inner work, was realizing, wait, actually, I'm the boss of my birth. They're just there
that
to
inner
support
work.
me.
And again, that it's courageous conversations where you learn to use your voice. And that is, I think that's a number one way to avoid birth injuries, is learning to use your voice and to speak your truth, right?
Yep.
Exactly. And a Body Ready method would not exist. I'm sure what you're doing maybe wouldn't exist without, I found, not my first birth, but my second birth, I found my power, I found my voice, I found my autonomy. I realized, oh my gosh, I literally couldn't fall asleep after that birth. It was 1:54 a.m. when he was born, and I was like, my husband really wanted to sleep. And I was like, people need to know, right? And it was I became like it's the portal to who I am now. Like I would not be, we all still have our struggles, we're all growing, but like the confidence, the ability to show up here, that would never have happened without me finding it through the portal of birth. So
yeah, it's definitely a great opportunity. Yeah.
Well, this was so good. Everyone follow Sandy. She's amazing. Does so much good work. You'll see her if you take our pro training, leading some of the tool times and the study sessions, and she has great insights in our Facebook group and all those things. I'm just super grateful to be in community with you, Sandy.
Yeah, well, I really appreciate. Yeah, exactly. Empowering the future generations by empowering the parents now, right?
Yes. That's the mic drop. That's the end. So we'll see everyone soon. Thanks, Sandy.
Have a great day. Bye.